think there's more of a buzzword around perimenopause. So I'm definitely having people come and see me in my usual clinic or in Ali as well, asking how do they prepare for perimenopause? Like, what is it? Do I need to take HRT? Like, lots of questions. So I guess my approach is always firstly just being curious. What are they experiencing themselves? What are their symptoms? And you've already gone through a whole list of all of the, classical and then more atypical symptoms in your list earlier. Finding a little bit about their general health, maybe their risk factors for HRT, maybe why that wouldn't be appropriate for them. I ask a lot about their lifestyle because I think, as you were saying, the whole point of your slide, Storm, was about sort of early intervention is best. And if you can get someone in that cusp of perimenopause who may or may not be exercising, may or may not be eating very well, may not even really thought about any of this stuff yet, they're the perfect people to navigate that moment of time before the estrogen starts to kind of, because when they're coming to me at that point, like your graph showed that it's this like roller coaster of hormones. It's starting to go down, the estrogen is starting to go down, but at the moment they're still okay. From a bone mineral density perspective, cardiovascular health perspective, they're just on the precipice. So it's a really nice time to catch them at that point. So after I've taken a really big history and I've talked to them about what their priorities are, what their sort of concerns are, I personally do a bit of a dive into some of their risk factors for things like mental health, sexual health, bone health, brain health, like mood and all that sort of stuff. Because I think sometimes when you go through perimenopause, your brain feels like it's been hijacked by some outer space thing that all of a sudden you just don't work anymore and you can't remember anything. And it's like trying to work through mud. So that can be really quite helpful to people just to sort of tease out what those things are. In terms of like tests and things, like a lot of people want to have tests. They want to know what to do. And, typically hormones, as your graph beautifully showed, hormones are really hard to test because it depends in which snapshot in time you get that hormone. You might do a test today and it's your estrogen's here, and then you might do a test 6 weeks time and it's up here, and then it can be all over the shop. And I see that at work where someone has had some blood tests where someone did do some of their hormones maybe 6 months ago and it looks like they're in menopause. And then I see them and they're having a heavy period. So it's just all over the place. That's always a really good moment in time to ask them about their cervical screening and some breast screening, things like that. But I have started in my practice to talk to people about bone health as well and see if they're interested in having a bone scan. Because it's not something that people think about. People don't come to me saying, oh, I'm worried about my bones. Because you don't know that you've got thin bones. You don't know that you've got honeycomb bones that are going to break at any point because you don't have any symptoms from that until you fall over and you break yourself. So it is kind of one of those little silent killers. So I think it's really important that it does get discussed. Unfortunately, one of the reasons it's not promoted is to get a bone density scan. And to answer one of the questions earlier, a bone density scan is essentially an X-ray where we look at the lumbar spine and the hip, and they look at the density of those two areas. It's a very quick, very simple test. But it's about $100 if you don't qualify for a rebated scan, which is actually not that expensive in the context of things. But you can't get one under Medicare until you're 70. And so if we know that your bone loss declines, by 10% in the first 5 years after your last period, you kind of missed the boat. Like by the time you're 70, you've already got fragile bones. And so there are a few conditions where you can get one a bit earlier that people may not know about. And that's, I guess, if you've ever had, like a digestive problem like celiac disease or Crohn's disease or ulcerative colitis where you don't actually absorb nutrients very well. Some chronic conditions like rheumatoid arthritis or thyroid problems. Medications like corticosteroids. Some people are on steroids for a variety of skin, lung, joint disorders. What else do we do? There's early menopause, periods of being underweight for a very long period of time. So obviously we worry that maybe they've been so underweight that they've actually lost their period for a period of time. So maybe the estrogen has gone low for a period of time, or puts you at a risk factor for having reduced bone density.